Hey there, Jennifer here. Today we are cracking the code on treatment for non-fluent aphasia. So after last week's video on treatment for fluent aphasia, this week I will go over the treatment techniques for non-fluent aphasia. Remember that Broca's aphasia is the most common type of non-fluent aphasia, and it's a bit easier to work with because patients are going to have relatively good comprehension skills. That means they're going to be able to understand what we are asking them to do. Do you need to check back on the two main aphasia types? If so, click the link above. Also, a very important thing to keep in mind when treating aphasia is that the goal is to increase communication. Most people with aphasia are more bothered by speech difficulty than reading, writing, and even their ability to understand others. Again, the WALC, W-A-L-C workbook for aphasia is a huge help and is generally what I start with in therapy. I'll attach a link. But Google can also be a good starting point if you need ideas or pictures. So I want to start by going over something called a cueing hierarchy. You will find this to be extremely helpful when you are trying to help your loved one find a word if they're having trouble. When you use these type of cues, you want to start with the least amount of help, and you want to work your way up to the most amount of help. I'll attach this list in the description section below. I like to refer to this as the cueing hierarchy for verbal expression. So we'll practice by doing, let's use the word coffee. So the first cue you start with is called semantic, which is you describe the word. So you would say, it's a hot drink. Number 2 would be function, location. You drink it at breakfast. Number 3, using a synonym or an antonym. You could say something like Folgers or decaf. Number 4, rhyme. It rhymes with toffee. Number 5, spell the word. C-O-F-F-E-E. Number 6, sentence completion. Pour me a cup of. Number 7, give the first sound. It starts with K. And I'll tell you number 7 is the one that usually helps most people the most. So just be giving them the first sound. And number 8, imitation. Say coffee. Now the cool thing is, after you work with your loved one on using these cues, you will find which ones work the best, and then you can use these cues whenever you're out with them in the community so that they're able to speak for themselves and you're not having to do all the talking for them. Okay, so now that you know the cueing strategies, let's get into the specific treatment techniques. Similar to treatment with fluent aphasias, if your loved one has severe Broca's aphasia, then you're going to want to start at the single word level, and you do this using sentence completion tasks. Examples of these would be a cup of blank, or put the stamp on the blank. Or you could even say, we wear our shoes on our blank. You're going to have them fill in the blank. Now, when you're using this, be sure that you use sentences that will only have one obvious and correct answer. So that means to avoid using sentences like, at the office, I used the blank, since there's going to be lots of different answers. Remember, the goal of this task is for your loved one to think and say one word, so you want to make it obvious. Next, you'll want to have your loved one repeat words or short phrases. This task works on the mechanics of speech. So when you're doing this with your loved one, you want to use words and phrases that they will most commonly use, like, how are you? Help me. Thank you. Bathroom, and so on. You don't just want to pick random words and phrases. This is going to keep them interested, and they're going to work much harder at repeating and trying to get the words across. So then you want to move on to work on something called confrontation naming. To do this, you're going to show your loved one an object or picture, and then have them name the item. So if you showed them a picture of a spoon, you expect them to say spoon. Now, while this may seem important, you don't want to spend too much time with this activity because research has shown that the effects are not as durable, meaning they're not going to carry over as well. But with that being said, when you are working on naming, again, you're going to want to find words, names, places, whatever, that are important for your loved one to be able to say, just like with the picture repetition task. Okay, so after naming, it's time to move on to phrases and sentences. So we've mastered single words, so on to phrases and sentences. There are several different ways of generating longer phrases and sentences, so I'm going to run through these fairly quickly. Imitation is the first and easiest way. You say a phrase or sentence and see if your loved one can repeat it. Next, there are repetition drills. Ask your loved one to sing happy birthday. Maybe have them count to 10 or name the days of the week. You can also have them practice answering questions that are meant to produce automatic responses, such as, how are you? Or when is your birthday? Okay, so from there, then you want to move on to story completion activities. For these, you will say 1 to 2 sentences to begin a story, and then you're going to have your loved one say a sentence to finish it. Then you want to work on question-answer drills. This is done by asking your loved one questions specific to them, like a personal experience or sharing an opinion, and then have them respond using a sentence. An example of this might be, what is one of your favorite hobbies? Now, the next 2 tasks are story and picture story elaboration tasks. These tasks are hard because they make your loved one understand and hold on to longer pieces of information in order for them to predict what might happen next. You do this by telling them a story, then asking questions that they must answer using a sentence. Or you have them look at a picture and give a sentence about what they think might happen next. And finally, there are sentence construction tasks where you would give your loved one 1, 2, maybe even 3 words and have them create a sentence using the words. So for example, you might give them the words from and road, and they would have to form a sentence, like, I went from one end of the road to the other. You can make this task easy or difficult depending on how many words and what type of words you give them. Like nouns are going to be easier words than adjectives or adverbs. Okay, the road doesn't stop there though, caregivers, because after your loved one has mastered phrases and sentences, the last piece of the puzzle is conversation. Just like how understanding conversation is the most difficult for those with fluent aphasia, speaking in conversation is going to be the hardest for those with non-fluent aphasia, because it requires speech and thought to be smooth and connected. Oh, and remember that not everyone who suffers a stroke will be able to regain speaking fluently in conversation, especially if their stroke is really severe. So you may never make it to using these treatment ideas. But if your loved one is ready to begin talking in conversation, they must start by learning how to produce connected speech. So to do this, you want to have them try one of the following 3 activities. Number 1, picture description. Find an action picture with lots of detail and have them describe what they see or tell a story about it. I usually use pictures from magazines, or I'll look even on the internet to find just a picture scene with a lot going on so that they have more to talk about. Number 2, procedural dialogue. Here, you're going to ask your loved one to tell you the steps to complete a task. You want to make them be detailed. Examples of this would be, tell me how to make a peanut butter and jelly sandwich, or tell me how to change a tire, if your loved one knows how to do this. And number 3, conversation. Yes, it may be just as simple as having a conversation to work on speaking in conversation. But understand, caregivers, that at first you will probably be doing most of the talking and asking a lot of questions. But over time, you should see them improve and they may even ask you a question or two. Well, that's it. It really is an exhaustive and extensive list, so don't get overwhelmed. Go slow, achieve success over time, and then try the next task. If that gets too hard, go back. And don't forget to use the cueing strategies you learned at the beginning of this video. This is really important. Also remember that if your loved one doesn't work on their aphasia, then they're going to be stuck in that level of aphasia. So if they can only produce single words and they're never to work on that skill, they'll probably only be able to use single words. So be motivating to them and find what makes them want to talk. Please comment down below if any of these activities were helpful or if you have any questions. And subscribe if you like this information. I'll be posting much, much more. See you all again in a few weeks. Thanks again for watching. Until next time, good luck cracking the code.